looking ahead to the next decade and the advancements we've made in disc replacement in the last 2 decades, we're on to now second, third, fourth generation discs for both the cervical and lumbar. But I'm going to change course to look at the next decade. I think the next decade, we're going to be seeing a lot less metal and a lot more biologics. And this is something that we're going to leave to the next generation of spine surgeons. We've already participated in 2 different disc regeneration FDA trials for different injectable materials to make the disc regenerate. We're not there yet, but if research continues, I think we're going to see that. The other thing that I see happening in the next decade is smaller incisions and less use of X-ray in the operating room. By that I mean I'm seeing some incredible work done by mostly the next generation in endoscopic spine surgery that can be done with a Band-Aid size incision home in a couple hours. And then with robotics and image guidance, the decreased need for using X-rays, which protects both the patients and the surgeons, frankly. So these are the things in the next decade I think we're really going to start seeing become more prominent. So we always try to make something good happen out of something bad. Obviously, the pandemic is terrible. A lot of people have lost their lives. And for a while, people weren't able to access elective surgeries, justifiably so. But we're back to full speed in elective surgeries. But the interesting twist that has really turned so positive for both us and our patients is telemedicine. There were some very iffy laws regarding telemedicine interstate prior to the pandemic, and through both legislative as well as insurance barriers being broken down, we're able to do up to 20-25% of our patients now via telemedicine. And particularly for us, since there's not a lot of centers that offer disc replacement, we get inquiries from all over the country. And to have our first visit on telemedicine, it saves them a trip if they're not a candidate. And it's a way to introduce to see kind of what the options might be for those patients. So I would say number one, telemedicine. I would say I really hope telemedicine is here to stay. I think there's cost savings on both ends, both for the patients as well as the payers. I think we can get patients to experts that may not have simple problems that can be handled locally or in rural areas. So I'm hoping it's here to stay, and we plan for it to be a significant part of our practice going forward.